My name is Dr. Hari Iyer. I'm a hand and upper extremity surgeon, and I work at the Center for Hand and Upper Extremity Surgery. Another very common fracture of the wrist is fractures of the scaphoid. The scaphoid is a very small bone that sits here at the wrist joint, and it really sits kind of at the pivot point for the thumb. As you can imagine, that makes it a very important bone. And it's crucial for the functionality of not only the thumb, but also the wrist in space. The blood supply to this particular bone is very fragile. And so sometimes the trauma itself can disturb the blood supply. Because of this fragile blood supply, and because of how important that bone is, we usually recommend surgery. When we do this type of surgery, we can do it in one of two different ways. We can do it open, or we can do it minimally invasive. Our surgeons at our practice are very well versed when it comes to minimally invasive surgery. And what we like to do is we like to put a single screw across that bone to help hold it into place. Now, again, because of that pesky blood supply, that bone can still fail to heal. And sometimes it can actually go on to what we call a non-union, where the fracture stays open and it doesn't knit across. In those scenarios, for this particular bone, it can be very difficult to get that non-union to fully heal. Again, we specialize in non-unions in the sense that we can actually perform new techniques that have been described over the last 5 years regarding different ways to fix the scaphoid with plates and screws, as well as using different types of vascularized grafting procedures to help get that bone to heal appropriately. Why is it so important? And the reason why it's so important for that particular bone is because if you don't get it to heal, it can put you on a path of degenerative arthritis. And patients who ignore these types of injuries will end up having arthritis set in the wrist within about 5 years, to the point where they won't be able to use that wrist anymore. It'll become painful, it'll become unusable. A primary fixation of a scaphoid fracture, if we caught you as soon as the injury happened and we're ready to do the surgery, the recovery time is actually fairly quick. We can let you out of the cast in about 4 weeks and maybe transition you into a removable wrist brace. We can start doing therapy earlier and sooner. When it comes to doing non-union type surgeries for the scaphoid, doing that secondary reconstruction because it didn't heal the first time, the recovery time for those types of surgeries usually lasts about 3 months.